Breast implants usually last for 15 to 20 years, and after that the patient can choose to get them replaced, or if the patient has taken care of them well enough, then there is no need to change them even after that amount of time. Hi, I'm Dr. Arjun Handa, plastic surgeon and body contouring expert at HandaAesthetics and Plastics. So what is breast augmentation? It is a procedure in which we increase the size of the breast. There are many ways by which we can do it. We can do it by putting implants in the patient. We can do it by fat grafting. Each method has its own advantages and its limitations. So here we are going to talk about breast augmentation with silicone implants. So implants are put under the breast or under the muscle, which is again under the breast, to increase the size of the breast. In an implant procedure, the advantage is that it's a single stop procedure as compared to fat grafting, where it has to be done again and again. Another advantage of implant is that the results do not fluctuate with weight, and also they last for a long time. Breast implants usually last for 15 to 20 years, and after that the patient can choose to get them replaced, or if the patient has taken care of them well enough, then there is no need to change them even after that amount of time. So this is a 24-year-old female who came to us with the complaints that her breasts were very small and she wanted a larger size. Also, she had a lot of lack of confidence in her daily routine life because of the size of the breast. She was afraid to wear certain types of clothing and she wanted her body to look a little better. On examination, we also found out that her breast on the left side was slightly larger than the right side. That is, there was some asymmetry between the two breasts. So in this case, what we chose to do was, we put a smaller implant on the left side and a larger implant on the right side to compensate for the asymmetry that was naturally present in her. And another issue that she also said was that she felt that her nipple was slightly in a lower position. So that is another advantage of breast implant, that it automatically lifts the breast to a higher position because of enhancement. So this is the result after the procedure, and as you can see that her breasts are now looking symmetrical, the size is considerably larger, and she is very happy with what she got. This is the result that breast implants can give to you. The best part about this procedure is that it's a daycare procedure, that you can come in the morning, get it done, go home in the evening. You don't need to take any off from work. You can return to work even next day if you want to. The pain is minimal. Usually, most patients complain of heaviness rather than pain. And the heaviness is because the body takes some time for the weight of the implants to get used to it. And usually it takes about a week. But apart from that, the post-operative period is absolutely comfortable. Usually it takes about 10 to 14 days for everything to heal. The other thing that is required in the post-operative period is that the patient needs to wear a compression garment for at least a month. Now this compression garment supports the breast, keeps the implant against the chest wall so no fluid or blood can get accumulated, and helps the tissues heal adequately. But apart from that, there is no other post-op requirement. The patient can do their daily activities apart from exercise. The exercise can be started after about 6 weeks after the procedure. So in this case, we were able to achieve the symmetry. The nipple were lifted to a higher position without any additional procedure. It was just because of the implants that the nipple came to a higher position. So this is the side profile view. You can see that the chest is very flat, the nipples are extremely low, and the breast is a little saggy. After the procedure, the nipple have come to a higher position. There is a lot more volume to the chest, and the patient looks a lot more feminine and a lot more beautiful, and that is how she felt at the end of the procedure. So this is another patient who came to us. She was 26 years old. She had the same problem, that her breasts were too small according to her. So again, with a very small incision where we have marked below the breast with the red marks, through this incision, about 250 cc of implants were put on both sides. She did not want a very large increase in size, she just wanted a mild increase in size, and also the breast to look natural and not abnormal. So in the post-operative period, you can see that her breasts are now natural and larger in size. They are not looking artificial, and this is about at least 1 month after the procedure. The best part about breast augmentation is that you cannot see a scar. You cannot make out whether the implants were put from anywhere. So if you look at it from the front or even from the sides, you cannot see the mark from where the implants were put. The mark usually lies in the breast fold, and after 4 to 6 months, the scar merges with the surrounding skin and is indistinguishable. So you cannot make out whether the implants were put from there or not. This is a 43-year-old female who came to us all the way from Poland to get her breast augmentation. As you can see, her chest is extremely flat, there is no volume, and she wanted a more feminine figure. She wanted to restore her femininity and to look more beautiful. We put around 200 cc of implants on both sides, and as you can see, the result is beautiful. It's looking natural and it doesn't look like as if something has been put onto her chest. It looks complementary to the rest of her body, and that is how she felt at the end of the procedure. So let's talk about the post-operative period again. To reiterate, there is minimal pain. Most of the patients do not complain of pain. They usually say that they have some amount of heaviness on the chest, which lasts for about a week. This heaviness is there because the chest muscles are not used to the weight of the implant, and it takes about a week for the chest muscles to get used to it. After a week, that complaint usually dissipates and the patients are extremely comfortable. It's a daycare procedure. The procedure is done in the morning and the patient can return home the same day in the evening. There is no need to stay in the hospital. There is no off from work. Patients can usually return to work the next day or maybe after a couple of days. So this is also known as the weekend procedure because most of my patients come to me to get it done on a Friday. They take off on Saturday and Sunday and they are back to work on Monday. The next most important question in the post-operative period is when can we return to our daily exercise routine? So heavy exercises are to be avoided for 4 to 6 weeks. Mild exercises can be started at 2 to 3 weeks depending upon the frame and the size of the implant that has been put, but usually 3 weeks. After 6 weeks, heavy exercise can be resumed. Apart from that, the very important thing is to wear a supportive garment which we usually give to the patient. This garment is very essential to be worn 24 hours a day for at least 3 to 4 weeks. It keeps the implant in position, prevents any complications, prevents any fluid or blood collection, and ensures adequate healing of all the tissues. Apart from that, there is no other limitation in the post-operative period. It's a seamless procedure and it's done very smoothly. Thank you.